Hello, everyone. This is Dr. Mike Chua, physical therapist and certified dementia practitioner. And today we have a special guest. Well, first of all, this is a podcast for our ACG Alternative Careers Group. And we have a special guest today. Her name is Jaclyn, and she's actually part of the Bard company. They are basically selling peripheral vascular equipments or whatever. So thank you and welcome, Jaclyn.
Thank you. Thank you. Glad to be here.
So tell us about yourself first. Where are you from?
Yeah, so I'm born and raised just in a city just outside Toronto, actually.
Oh, wow.
So you'll hear my out and about. I'm sure you'll hear the Canadianness come out at some point.
Wow.
Yeah, I started working at this company actually in the city just outside Toronto, transferred down to our corporate home office in Phoenix, where I lived in the constant sunshine for 4 years.
Beautiful.
And it was. And then I wanted to get back into working with doctors more one-on-one, more in that clinical space. So I moved to Chicago and took a sales role, and that's where I am now.
Oh, wow. Oh, wow.
Mm-hmm.
So you mentioned earlier offline that you particularly work for Bard, and then you sell or basically promote peripheral vascular equipments. Can you tell us more about that?
Yeah, for sure. So the way our structure, Bard has multiple different divisions, so to speak.
Mm-hmm.
And a lot of medical device companies are set up this way where they'll specialize in maybe cardiology or some aspect of the healthcare field, but they'll have a whole variety of other disease states that they'll treat as well.
Mm-hmm.
So peripheral vascular is one of the divisions that Bard has. We've got, medical, surgical, a whole other array of divisions as well. One interesting trend that I'll just kind of touch on early that we see in the medical device space is there are a lot of acquisitions and mergers. So what we're seeing is that companies are getting bigger and bigger, and they're having a much more diverse suite of products that they sell, ranging from lower cost disposables like syringes and gauzes and that kind of thing, to the more technologically, advanced drug-coated balloons or stents, just to name a couple, and capital equipment. So there's a whole range of things that these companies are now selling, and the clinical need is usually quite high to have people on board that understand the space, understand how to work with clinicians, and can communicate to our audience in a non-sales way.
Mm-hmm. So basically, you're also looking for clinical people, right? Like therapists and nurses and stuff like that. So this is a perfect job opportunity or alternative career for our group right now, our ACG group. So tell us what are the initial qualifications? Do they have to have a bachelor's degree or an associate degree, or do they have to have a doctorate degree? So what are the other jobs that they can work with you guys? So is it you need to be just in sales, or can they go into a clinical or research position? So
yeah, and I mean, the industry is so largely run, for better or for worse, it's largely run by non-clinicians. So when anybody has some kind of a clinical background, it's very highly valued in many different departments throughout the organization. The one that's probably one of the most obvious is clinical education. And that would be
education.
So that would be more of like a clinical specialist type role. So if you were looking for an alternative career like that, one of the things you might type in is clinical specialist.
Clinical specialist. Okay.
Yes. And typically those are people who have, a lot of times they do have connections into the particular labs that we work in. Different companies will have different call points and look at people with different kinds of relationships, right? I can speak kind of for peripheral vascular cardiology, but that's often what we look for. And so also developing those relationships with people who work in the industry is pretty important. because they can really get you in front of the people that you need to speak to in order to show that you have those skills, right?
Mhm.
So field-based clinical education or clinical specialist is definitely one way. And that gives you a little bit more, depending on what you like, that still gets you more that kind of hands-on clinical side of it,
Mhm.
working with practitioners and working often with patients to a degree, right? Um, and it's field-based. So that
Okay.
comes with some of the benefits of not having to go into an office if that's something that you're looking to expand in your career, to have
Mhm.
some
A
of that,
lot,
more of that
a lot
freedom.
of our members in this ACG group, they're so much tired with everything. So this is a good alternative for them. So, do you mind me asking what are the products that they're going to promote or whatever? So.
Yeah, I mean, I can tell you a little bit about what we have at Bard, but there are a whole bunch of different medical device companies. And as I've
Mhm.
mentioned, how they're kind of merging a lot more,
Mhm.
there are fewer of them that are going to be kind of those big names, but they're the ones you're going to want to start to investigate. At Bard, we do things like stents, balloons to
Dent.
treat, that'll go
Okay.
inside the artery to treat that particular disease. Some of the other divisions will sell things such as meshes, like hernia mesh, that are used
Mhm.
in surgery. So sometimes, I mean, these clinical specialists often are going into the surgery. So they go in
Mhm.
there and they're able to actually teach the staff and the doctor how to use the product,
Oh
right?
wow, that's interesting. There.
Yeah,
Do you do that?
I do. I
Oh
do.
wow.
That's a big part of our job, and it is really cool. It's like that is a human being, right? And your
Mhm.
product needs to be used a certain way. And physicians they're busy. They're very intelligent, but their minds are on millions of different things when they're going into these procedures. And so having a rep there that knows how to use the product, even just in the case that something doesn't go exactly as planned, they expect the rep to be able to be there to help walk them through that.
That's so true. Well, I remember I used to be the director of a rehab facility and also the acute hospital, and we would get orders from physicians about wound care, and I don't know anything about wound care,
Mhm.
and they will order us what do you call this, wound vacs, and I don't know anything about wound vac.
Right.
I would call the rep, hey, how do I do this? I call them and they come in and take care of that, and that's a
Exactly.
good alternative career for our alternative careers group. And
Exactly.
I also went through what do you call this? I shadowed. I assisted the surgeon. Let me put my thing on the back. I assisted the surgeon doing their hip and knee surgeries, and it was
Hmm.
very interesting and
Yeah.
helped me a lot. So.
Orthopedics is another great, like companies like Stryker, Boston Scientific,
Hmm.
just kind of listing out some of the names, but Stryker does a lot of, some of the orthopedic type things. A lot of it is about networking. A lot of it is about
Hmm.
networking because I think within the group, within the alternative careers group, a lot of people do have the skills required, but it's how do we communicate that in the right language to somebody who
Hmm.
might not necessarily be clinical, who's the person that is responsible for some of those hiring decisions.
That's so
Yeah.
true.
Hmm.
So in your company, Jaclyn, should I call it Jaclyn or Jack?
The Jaclyn's good.
Jaclyn,
Yeah.
do you require an experience or no experience required? Are you going to train the employees? I mean, you are the training department.
Yeah, so we definitely have a training department. Um, for my division tends to be a little bit more, the products are in the disease are a little bit more advanced. So when we
Hmm.
hire, specifically when my division hires, we do tend to hire out of the labs that we work in. So usually that tends to be technologists or nurses that work in these particular, and I cover a small part of, Illinois.
Hmm.
Um, for me, it's a little bit more specialized. It's probably not an entry level, it's probably not a first job to
Mm.
be in this peripheral vascular space. But it's something to work towards for sure. So you could
Mm.
start at something that's more like you mentioned wound care. That'd probably be a great place to start because the barriers to entry are a little bit lower. You still get that one-on-one practitioner experience, and
Mhm.
your ability to be in front of a staff is easier to access. the challenge that we have with peripheral vasculars, it's not exactly easy to go, walk into an operating room, right? There's like a whole, it's quite a complex process.
You
But with
develop
wound
that
care,
relationship, right?
you do. So I think something like wound care would probably be a fantastic place to start. Or just some of the smaller divisions within these larger organizations where there's that ability to grow, right? So there's that opportunity to progress your career, regardless of where you start. And those positions are available. It's just a matter of getting in front of the right people.
There you go.
Mm-hmm.
So you mentioned wound care. So a lot of our therapists that are actually in our group, they're a majority, not all, but some have experience in wound care. So that's a good tip there. If you already have an experience in wound care, go ahead and try to look for a sales job in a wound care company in your local area, and start from there, or be a local rehab liaison. Is that how you pronounce it? Liaison.
Yeah,
Yeah, and you
and
start from there.
That stuff's great. And I can tell you, just from a progression standpoint, peripheral vascular does tend to be, in the cardiology, tends to be, a second or third career move, but it is closely related to wound care. So for example, if I had a resume put in front of me and someone was like, I have this many years experience in wound care with X and X, physicians or whatnot, that matters because a lot of people who have peripheral vascular disease have wounds, right? Often they have wounds on their feet. Podiatrists and people who work in wound care clinics, they tend to be our number one referrers to our cardiologists. So that matters. It's all about this network, right? It's all about, they'll see that on a resume and be, oh, this person has a network and some connections and the skills that are going to be valuable to us. And that's kind of what a company looks for. So I think that's a great place to start, really.
Excellent. Thank you for sharing that and for that tip for our members here.
Absolutely.
And let's go to the big question. Okay.
Okay.
How much do you, I'm open to it. I don't know if you know it. I used to be a pharmaceutical rep. I worked as a medical representative for more than 10 years, not more than approximately 10 years. And I traveled around the world because of it. And now I'm here in America because of it. And money is really good. So one of the motivating factor for us, therapists and, in our group is obviously getting out of the therapy world at the same time, earning a good enough money to not only help our family, but help other people too.
Absolutely.
So how much does, on an average, on a scale, would it be worth it for us therapists to transition to an alternative career like yours? So how much would it,
Yeah, I think often it is. And so I'll give you a couple different examples, because we did really mostly talk about the field-based clinical educator, but there are other roles as well that I think are worth mentioning. They might, like, some kind of marketing type roles are available. Clinical research is also another thing where I think your audience could really have some skills that could be very useful to a clinical research department, if that's where, like, setting up clinical trials and all of that. And they all are a little bit different, but they all pay pretty well. So I would say very base, you could, there's also a role that would be called like an associate sales rep or junior sales rep, which is also a very good place to get in, because usually those roles are designed to be temporary. Let's test you out as a sales rep. And if you're good, then we'll move you into a sales rep role within a year or so. They're usually little trial roles. Those ones, they don't typically pay as well. That might be about a $70,000 with base with some bonus. It's a little bit of bonus. I mean, it's still good, right? You'll get a car.
Yeah. Oh, wow. Yeah. I remember having a free car.
Free car is really, really nice. Never underestimate the free car. It's really awesome. Might be a little bit less than that, but give or take, it's going to be, around 70,000 or so.
70,000. Okay. I think it's going to be like the same as an entry level therapist too. I started here in the States, probably like 50 and 60 range as a physical therapist. And, if you're even outpatient therapist, that's what they earn now. So if you're going to have like 60 or 70 base pay, that'll be awesome. Plus bonus, plus car, plus
It adds
free
up.
hotels and stuff like that.
It's nice.
Town, out of state meeting. So I think it's going to be good for our members in the group. So
that would be like an associate rep position. And it only goes up from there. So like
oh wow.
a clinical educator, and I'm really only speaking from my kind of space and my knowledge of that, is they're usually going to be looking towards like 80 to 90,000 with a bonus with a car, right? So
Oh,
there's that as
wow.
well. Sales tends to be the golden ticket. I mean, people want to get into sales.
Yeah.
There's a base salary that comes with that. That's usually not that high. It's usually about 70,000, which is still, I mean, it's still good. But the majority of what sales reps make is in commission. And good reps, are easily making, 160, 70 plus.
Wow.
Good reps. You have to be a good rep. It's a very competitive industry. It's not easy to get into. It's not an easy job. It's high pressure. However, it is not to say we have definitely hired people in that were technicians or whatnot. We hired them in to be a clinical specialist. They really wanted to become a territory manager or a sales rep, and they got that role and were really successful. And there's a lot of perks that come from being a very good sales rep. Like that's just the tip of the iceberg. There's a lot to that.
I bet. Yeah, I've been there. So I remember those special bonuses and commissions, end of the year bonus and stuff like that.
Win trips, all that kind of stuff.
Oh, yeah.
I mean, all that to be taken with a grain of salt, and that like sales it's high pressure and it's not easy. But if you're super motivated by that kind of stuff and want and have that, if I work really hard, I will get more mentality, it's the place to be. Absolutely. And I think medical sales is probably one of the top most lucrative industries to be in with respect to sales. A clinical educator position will be significantly less pressure, but you still have that nice steady paycheck. It depends on the company how big your geography is going to be. Some companies have you're going to have to do some overnights, which people don't really like sometimes, right? Depending on where you're at in life, right? Some people like them more, but my clinical specialist here never has to do overnights. It just depends on what's available. And I think when you start out, just the more you can allow yourself to be flexible, like, can you take a bigger territory? Can you maybe make a little bit less money to start with because there's the potential to grow later? Those positions can be really quite lucrative.
Okay. So you mentioned about clinical educator. I think a lot of our members are going to be interested with that. So what do they do? I know they educate clinically, but what do they do? Do they go to the hospital and educate the physicians and other employees, or what do they basically do?
So in my particular circumstance, and what I see a lot of other, clinicals and reps do this too, we just kind of do it together. Yes. So we in-service the staff. So we'll have a new product or some new data or some new research, and we'll go there and we'll set up a time and we'll make sure that all of the staff knows what the new product is, how to use it, the staff has to prepare the product to give it to the doctor. So when they're in surgery, right, when they're, preparing the product and the doctor is standing there, like, hand me this, right? They need to know how to hand it to them so it's ready, right? So they'll teach the staff, here's how you prepare this product. Here's how it's deployed. Here's what the doctor might ask you. Here's what could go wrong, right? If this goes wrong, here's what you do, right? So you help them, you help the staff understand why they're using the product, and help the staff help the doctor, and then you'll train the doctor as well. So doctors, they got 5 minutes for you. They'll come in, oh yeah, I know this. Like, oh, what's, they'll ask their couple little pointed questions. You answer them really directly. And then it's about finding out, once everyone's trained, right? A lot of it is case support. So then it comes down to, okay, we have a procedure. As patient qualifies to use your product, we want to use it. Can you come support this case? And so then you put it on your calendar, you go to the hospital, you get into their scrubs, you go into their, whether it's an operating room or we work in the cath labs a lot, or interventional radiology. You go and you scrub into their clothes, you go into the room, and you help with the case,
A
essentially.
lot of our therapists will be very interested in that position. But I also remember when I was a medical rep, I remember we had product specialists, and they'll be the one who's going to be launching the specific products. And, I was once like that too. I just can't remember. But we had roundtable discussion, and we'll do some specific symposiums for that specific products, and make a big, launch out of it. And
Yeah.
I think I remember now. Yeah. Mm-hmm.
Yeah, and so often what I see as a clinical specialist and the territory manager or salesperson work very closely together.
Mm-hmm.
So we'll work together to set up these. I mean, you can't just teach people something once, right? Like they don't remember. So this is an iterative process of continuing to make sure people have the best education, and they know how your product compares to the competition, and they feel really comfortable with it and really like it, and like you, right? Ultimately, you end up being in their lab so much that they get to know you and they want to like you. So having that good energy and that good personality, and we know what it's like to be. It's healthcare, right? So the
Yeah.
people that are working in these places, they're working long hours. They're on call. They got called in at who knows what hour at night to cover an emergent procedure, and sometimes just having that positive energy around them, it makes a really big difference.
That is so true. And that's the one thing that I'm going to recommend for our ACG people here who's listening right now or watching. You need to have a good energy. If you want to go into that alternative career that you're trying to look for, whether it's a sales job or any kind of job, you need to have an energy to come in, because if you're in that negative mood or position, how can your new job accept you? You need to have a good energy. So that's a good point there, Jaclyn.
Yeah, I mean, I was just going to say, so much of the hiring on it is based on, in this industry, it's on personality and skill. You have to be able to combine them together. If someone could be super technologically great and look great on paper, but if you don't want to hang out with them, it's very social. So that is
so true.
Mm-hmm.
So true. I once worked with a very knowledgeable PTA. She knew everything, and she's very knowledgeable with everything. Hands on. She's good. Manual therapy, therapeutic exercise. She's awesome, but nobody just likes her. So I just can't give her patience because nobody wants her. So.
Right.
So we've been talking about, let me change the gear a little bit.
Sure.
We've been talking about all these positive things about, sales career, DME, medical equipment stuff. So what are the bad, cons or problems being in this job?
Well, a lot of people do think it's great. I mean, people really want these jobs. They're hard to get. I would say that's probably one of the more challenging things. Is it can be grinding trying to. You have to speak the language, right? You really have to speak the language and make those connections, and so getting in can be hard. And then once you're in, some of the challenges might be. Sales definitely has the pressure component that comes with it. It's sales. Definitely. It's to be expected. Sometimes that does trickle over to the clinical side as well. We are all accountable. We're very close-knit teams. We're all accountable to hit that number, right? We all are striving towards that goal. So sometimes there can be a little bit more pressure than a standard 9-to-5 job. It just is. The hours can be good and bad, right? So sometimes you might not have a case that starts at 9. Great, no problem. You could leave your house at 8:30 and get there. Sometimes you're going to have a case that's an hour and a half away, and the patient's supposed to be ready to go at 7. So okay, well, that's going to be an early one for you. It's a little bit more unpredictable in terms of what your caseload might be, but ultimately, once you get comfortable in the role and you get to have these relationships with these physicians, you can have conversations with them. So if I'm not here, are you comfortable still using this when I'm not here, right? But it takes a little while to kind of get. So if you have to leave to go and get your child or whatever it is you might have to do, it can often be worked around, but it does take some time. It's relationship dependent.
That's
You know?
so true. That's so
Yeah.
true. I remember when I was a rep, we would wait for this doctor because he would not let reps to come in up until 10 in the evening. We would wait until 10 in the evening. And I've developed the relationship already. So instead of me going there at 10 in the evening, I would go to him at 9 in the morning at his house instead. And, just saying hi, hello to his family. And my coverage is done instead of waiting for him up until 10 in the evening, and
Right.
lining up with other reps. So relationship is the key, having a good, network and influence in your area. So that's pretty good. Thank you very much for sharing that,
Yeah,
Jaclyn.
absolutely.
So last but not the least, you do have a coaching program, I believe.
I do. I do.
So, I mean, who do you coach? What do you coach? What do you do? And could you help our group find their alternative career? Can you help us do that? I mean,
Yeah. So what I essentially do is I work with people who are typically quote unquote high achievers. These are smart people who have got a career that is a great career, but they're either just kind of feeling burned out from it, or it's not really what they thought it was going to be. Right. And
gosh,
unfortunately this happens, right?
yeah, it's perfect for our group. We've got 7,000 members. These are all high achievers. These are
Right.
all, I mean, the minimum is probably associate's degree because these are
Right.
PTAs and quotas, but the rest is some PTAs, they have bachelor's degree and OTs who have master's degree
Right.
and PTs who have doctorate degrees. And I know this group is just high achievers and they're just burnt out. So this is
Absolutely.
perfect for you. So what can you do for us?
Yeah, so essentially I work with people through any stage along how do I manage this burnout? So sometimes you're
Mhm.
in a situation where you can't really make a change at that moment for whatever reason. So how do we set things up so that your life is conducive to enjoyment without being completely burned out, right? Through to, well, let's discover what is your passion? If it's not this, what is that? And then how do we transition into it? So kind of along this whole spectrum. Let's find out what it
Mhm.
is you want, help you transition into it by working with some of your core values and really digging a little bit deeper holistically into who you are and what makes you happy, right? How do you want to be in the world? And then how do we kind of translate that into the language that an employer needs to hear so you can get those jobs? And then once you're in them, how do you become really good at it? So really that personal development and self-mastery that comes from that continuous commitment to always wanting to grow.
That's so true. That's so
Yeah.
true. Self mastery and the commitment. That's the word that I'm looking for. You got to be committed to change. You
Right.
just can't find your alternative career if you're not committed to change. You got to change something. If you're burned out with your job right now, you got to learn how to change. If you cannot change your current environment, change yourself first. And that way you can move on forward to your next ideal career. So, do you have a website that we can go to, Jaclyn?
I do. So my business is called The Cultivated Career.
The
And
cultivated career. Okay.
yeah, it's just www.thecultivatedcareer.com. And I've got my blog. I've got some free resources up there too,
Okay.
with respect to some worksheets and a little free course if you want to just get a feel for what your true passion is.
Awesome. Well, I'm going to do a shameless plug too. We also have a DISC assessment course. I did this for our group, ACG Alternative Careers Group. So if you are interested in identifying your ideal career, there's a DISC course and DISC assessments like a strength finder thing. So I assume you also use an assessment finder, Jaclyn?
I'm really based on values. So like
Mhm.
I kind of just dig into it at a values level. We've got a worksheet to kind of just
Okay.
assess where you're at. And then I use that to really guide how we want to develop your strengths and
Good.
communicate
Good.
them.
All right. Well, again, thank you very much. What's your website again?
It is
Mhm.
www.thecultivatedcareer.com.
Cultivatedcareer.com. All right. Again, thank you very much, Jaclyn. We
Thank
appreciate
you.
you. If you're interested in pushing and moving to your next career and getting more out of it, and reach out to Jaclyn and check out her website, thecultivatedcareer.com. Again, thank you very much, and I wish you all the best and have a great evening, ACG. Bye bye.
Have a great one.
Hello, ACG. I got a special discount code from MedBridge. If you need CEU and home exercise program, use promo code alternative or Dr. Mike to get an annual MedBridge subscription starting at $200, over 40% off. Imagine that. Gain access to 1,000 plus online courses, compliance training, certification prep programs, and so much more. So if you're interested, go to medbridgeeducation.com/TN Therapy Outsource or put in the code alternative or Dr. Mike. Thank you. Bye-bye.